Hello, I am here to talk to you today about fentanyl and how it is in our communities and is now a public health crisis. Fentanyl is the leading cause of death for Americans ages 18 to 45. This synthetic opioid is devastating communities like ours across our state and across the country. There was an article in August of 2025, so just 2 months ago, that Doñana County reported 21 overdoses, with 5 of those resulting in death, and the majority of those were related to fentanyl. I am a resident of Las Cruces. I am a mother, and I am connected to the New Mexico Department of Health. And so I have been able to do a lot of research and find a lot of data about how fentanyl is impacting our community and communities like ours across the country. So today we're going to talk about 3 key aspects of fentanyl. First, we're going to talk about how dangerous and deadly fentanyl is. Then we're going to talk about who's making it and how it's getting here. And lastly, we're going to talk about what our area is doing to combat this crisis. So when it comes to fentanyl and how dangerous and deadly it is, fentanyl is 50 to 100 times stronger than morphine. So if you looked at just a few grains of the salt, that is all it takes in fentanyl to be fatal. Fentanyl is being pressed and mixed with other drugs to look like legitimate medications. So if you buy or get a Xanax thinking you're just going to relax, you could be ingesting fentanyl. Now, the biggest problem with fentanyl is that it acts extremely fast. So within minutes, you will have respiratory failure. Now, unless you have a naloxone kit, which is about the only thing that will combat a fentanyl overdose, the odds of you making it through that overdose are extremely small. Now we're going to talk about who's making it and where it's coming from. The majority of fentanyl is produced by the cartels. They are produced in these really sophisticated labs, and then they are being smuggled into our country and into our communities by either through the ports, through the mail, or just across our borders. So with that being said, we've now talked about how bad it is, where it's coming from. So we're going to talk about what our area is doing to combat this crisis. So there are a lot of organizations here in Las Cruces and Doñana County that deal with this fentanyl issue and issues basically like it. So the New Mexico Department of Health, as an example, has several programs. We deal with addiction, get you set up with services. We have syringe exchange. We do the naloxone distribution, those kind of things. So if you have any question, please go see the New Mexico Department of Health website. You can also find out a whole lot of information just about fentanyl on that website and how it is impacting our state. Now, there was an article done by Hot 103, the radio station, that they had done a news report on the Las Cruces law enforcement and how they've been involved in an initiative called Operation In Vain that was done April through June of 2025. And over 2,300 fentanyl pills were seized during this initiative. There was also a lot of drug busts and a lot of arrests made during this initiative. So they are obviously our law enforcement is mobilizing, like they know that there is a problem and they are doing everything that they can. So when it comes to our area, um, we are definitely having to deal with this. Fentanyl is not a drug problem. It is a national security, it is a public health, and this is an ethical issue. It is claiming the lives of our neighbors, overwhelming families, and challenging the systems that are set up to protect us. The 21 overdoses that included the 5 deaths are not just an isolated incident. Those are not isolated incidents. Those are part of an overwhelmingly growing wave that demands our attention. Awareness is only the beginning, though. It's going to take advocating for education and prevention, demanding accountability for those who are fueling this epidemic, and it is going to require all of us making making awareness. Um, beh- Behind every statistic is a person, um, and a life that could and can be saved. So I appreciate you listening. I urge you to look more into this subject. There's so much information out there, and be aware of your surroundings and the things that you are taking.